I will already remove the parotido-auricularis muscle along with the parotid salivary gland. So if I reflect this, I can see the deeply located common carotid artery. So if I reflect it, I can see the common carotid artery. So in case of large ruminants, this is a specimen of buffalo calf. So in large ruminants, you see the trifurcation of the common carotid artery. You can see this one is the occipital artery. You can see occipital artery. You can see this one. This is the trifurcation. This is the point of trifurcation. This is the common carotid artery. So this one, this is the first branch. This is the, you can see this one. This is the occipital artery. It is going into the cranial cavity. This is the occipital artery. This one, occipital. This is the external carotid artery. This is the second branch, and third branch is the external maxillary. So external maxillary, external carotid, then occipital. This is the trifurcation of the common carotid artery. You see the location of external maxillary artery. This is the junction between the vertical rami of the mandible and horizontal. This one is the horizontal rami of the mandible. So I can call it as angle of lower jaw. So this is the location of external maxillary artery, very deeply located. But in case of horse, this external maxillary artery actually passes at the medial aspect of the angle of jaw. So at this point, we can put our finger for recording of the pulse rate in case of the horse. So if I track the external carotid artery, I can track in this area. So I can keep aside the veins. So this is the external carotid artery. This is the external carotid artery. So if I will show you the external carotid artery, you can see one branch is coming out from here. This is one branch of the external carotid. If I'll pick it here, external carotid, you see this branch. This branch is coming. This one, this branch. This is the caudal auricular artery. Just like this one, caudal auricular vein. This is the caudal auricular vein. This is the external carotid artery, and this is the caudal auricular vein. This is the caudal auricular vein. Artery. This is the caudal auricular artery. Now, the external carotid artery extends, you can say ascends in upward direction. You can see ascends in the upward direction. If I will see this, you can see, if I will keep it here and keep aside of this one, I can show you. So you can see this is the caudal auricular artery. This one is the caudal auricular artery. This is the internal maxillary artery. You see, this is the internal maxillary artery. It is moving in the cranial direction. This is the internal maxillary artery. And the upper one which is going, you see, the upper one is the superficial temporal artery. This is the superficial temporal artery. Caudal auricular. This is the internal maxillary. You can see the internal maxillary artery where it is going. You see internal maxillary. And this one is the superficial temporal. This is the superficial temporal artery. And this superficial temporal artery, if we will go, this is the cornual nerve, and by the side of this one, cornual artery, one branch of superficial temporal artery is moving towards the horn area in the name of cornual artery. This is the cornual artery.